Hi, I'm Dr. Michelle Haynes,
I'm Dr. Kristen Lansiter.
and we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today, we're going to be making, I think this is our first video about infertility.
Yeah.
Yeah. So infertility is really complex. There's lots of different reasons that a person or a couple can have infertility. There's a lot of unknowns, right? Like if it's a couple experiencing infertility, it's like, oh, we don't know what we're dealing with. How do we approach this? So I think sometimes it can create some split, or what am I trying to say?
Can create some difficulties within the relationship.
Yeah, exactly.
Yeah. And 1 in 8 couples actually experience infertility. So while I think a lot of people going through infertility feel really alone and a lot of mixture of feelings, but sometimes there's shame or embarrassment, it's something that's actually not uncommon.
That's really common. 1 in 8?
Yeah.
That's really common. There have been updates to the ways in which we define infertility, so that might change those numbers too to include more people.
Yeah, that's true.
It can potentially cause some difficulties in relationships. So how does that show up? Maybe they're having arguments with each other, or there's this blame game, or there's an internal sense of shame, even if that's not coming from the partner.
Yeah.
So that can show up in a lot of conflict in a relationship.
Yeah, and it probably also depends on how that couple usually solves conflict or usually manages conflict. And even though it's not a thing that you're disagreeing about, it's still a big strain on the relationship.
Mm-hmm.
And one or both sides might feel resentment or lots of different things. And so it's really important when a couple or a person is going through infertility that they are doing what they need to do to take care of their mental health.
Right. So there is evidence to support there's this bi-directional relationship between infertility and depression and anxiety, right? That one doesn't necessarily cause the other, but they are related somehow. And my guess personally is that it's probably related to some of the stressors, or there might be a secondary thing, whether it's an inherent problem with inflammation, or there's a problem with the hormone axis, or there's something else that's kind of driving the two together. They don't always go together. So we wanted to mention that if you are experiencing infertility, it's really important to create the foundation to have the support network, to have the stability, to be able to lean on your partner if you have one, to support your mental health so that it doesn't come in and impact the infertility even more, right?
Yeah, and that you can have a good quality of life while you're going through such a difficult journey.
Right. So it's not your fault. We really want you to find support as you're moving through your journey. Yeah. And that could be with your partner and a couples counselor, in therapy yourself. Groups are an evidence-based way of approaching the situation, that you find some community in what you're experiencing, that you're not feeling like you're doing it by yourself.
We have a video of a lot of ways that you can support your mental health. I think it's a video about specifically decreasing your risk of postpartum depression, but those things that we talk about in that video can be applied just in general to mental health. And so go take a look at that video and see what things you can be doing just on a day-to-day basis to help support your mental wellness, that way you're taking care of yourself during such a difficult time.
Mm-hmm. That's a great mention. Good idea. That's a good one. Yeah. So go check out that video. Thank you so much for being here today. Please like, comment, subscribe, share with your friends. We'll see you soon.
Bye.